Thank you for joining the wellness program at Duren's Pharmacy. Today we are discussing medications used to treat high blood pressure. The topics we will cover today include a review of the goals for blood pressure. We will also discuss the different types of medications used to treat high blood pressure, how each family of medications work, and the possible side effects from each medication class. First, let's review the goals for blood pressure. The American Heart Association defines blood pressure as normal being less than 120/80, pre-hypertension being 120 to 139 on top, and 80 to 89 on the bottom, and hypertension being defined as 140 or more on top and 90 or more on the bottom. The first family of medications we will discuss is the diuretics. Diuretics are among the oldest known medications used for treating high blood pressure. Healthcare providers typically use diuretics as the first-line treatment for high blood pressure. These medications are often referred to as water pills. Many medicines that end in "-ide", "-one", or contain HCTZ are diuretics. These medicines may be taken alone or used in combination with other medications for blood pressure. So how do they work? Diuretics lower the blood pressure by helping your kidneys remove excess salt and water from the body. Less blood volume circulating through your body causes the blood pressure to drop. Diuretics are safe and effective. As with all medications, there are possible side effects. Weakness, fatigue, and leg cramps can occur. The diuretics may interact with insulin and your body's blood sugar control. And last, all the water and salt removed from the circulating blood has to go somewhere. Diuretics can cause an increase in urination. Alpha and beta blockers can be used for blood pressure and heart disease. They have been used for many years and work very well to control blood pressure. They may be used alone or in combination with other medications like the diuretics. Many medicines in this category end in "lol" or "sin". Alpha and beta blockers work directly on the heart to lower blood pressure. Alpha blockers decrease the nerve impulses that tell your blood vessels to contract and tighten. This lets blood flow easily through the vessels and blood pressure goes down. Beta blockers make your heart beat slower and lowers the force of blood going through the vessels. These medications may cause dizziness and weakness if your blood pressure drops suddenly. This can happen when you get up in the morning or stand up quickly. Get up slowly from lying or sitting to standing to prevent this side effect. You should keep a record of your blood pressure and pulse rate along with any side effects you may have, and then tell them to your healthcare provider or pharmacist. Now let's talk about the ACE inhibitors. These medications have not been around for as long as the diuretics, but they are safe and effective to control blood pressure. Medications that end in "pril" are usually ACE inhibitors. They can be used alone or in combination with other medications to control blood pressure. ACE inhibitors work by altering the level of a hormone named angiotensin II. This hormone is a powerful chemical that causes blood vessels and muscles around the vessels to narrow and tighten. The medication lowers the amount of this hormone in your body so that the vessels and muscles will stay relaxed and the blood pressure will go down. ACE inhibitors are harmful during pregnancy. Make sure your healthcare provider and pharmacist know if this is a possibility. These medicines can cause changes in taste, skin rashes, and a dry hacking cough. If you develop any of these side effects, let your healthcare provider and pharmacist know right away. The next family of blood pressure medications we will discuss is the angiotensin antagonists. We talked about the effects of ACE inhibitors on angiotensin II. Now we will discuss another category of medicines that will affect angiotensin II. You may notice that all of these generic names end in sartan. These medicines too are safe and effective for managing high blood pressure. Like most blood pressure medicines, angiotensin antagonists can cause dizziness and other side effects. Watch for any new problems when you begin taking these medications. Tell your healthcare provider and pharmacist if you are concerned about any symptoms. This class of medications is also harmful during pregnancy. Make sure all of your healthcare providers know if you are pregnant or become pregnant while taking them. Next is the calcium channel blockers. Some people refer to these medicines as the CCBs. They have been used for many years for blood pressure control and heart disease. Several of these medicines end in pine. As with other types of medication, they are used for both blood pressure control and to treat heart disease. Ask your healthcare provider if you are unsure why you are taking this medicine. It may be for either or both conditions. Calcium is needed for the muscles to contract. These medicines keep calcium from entering the muscle cells of the heart and vessels. This allows the vessels to relax and your blood pressure goes down. Some of these medicines, like verapamil and diltiazem, will also slow down your heart rate. Some of the possible side effects. These medicines slow things down. You may have constipation, swollen ankles, or a slow heart rate. As your blood pressure goes down, you may also have dizziness or headache. We've talked about medicines that work on the heart, the vessels, and chemically. Now let's talk about some that work directly through the nervous system. There's really no easy way to identify this category of medicines. You will need to ask your healthcare provider or pharmacist if you are taking them. This group of medicine works by stopping nerve impulses from the brain that tell your vessels to constrict and tighten. When the vessels remain relaxed and wider in diameter, your blood pressure goes down. These medicines stop impulses to the vessels, but they may also stop impulses to other muscles. As a result, you may have constipation. Other side effects include dizziness, dry mouth, and anemia. Vasodilators have been around for quite a while. They are useful for blood pressure control and heart disease. Usually they are not considered as a first-line treatment for blood pressure, but they are very effective when combined with other medications. Vasodilators are used for blood pressure control and for chest pain or heart attacks. They can cause significant drops in blood pressure, so they must be used very carefully. Vasodilators, especially nitroglycerin, have a strong and quick action. They work directly on the muscles in the vessel walls, causing the vessels to dilate. This relaxation causes the blood pressure to go down. Vasodilators also work on other vessels in the body, so other symptoms may occur. Due to this, your blood pressure can drop too quickly. Use caution when you begin to take these medications. Vasodilators do have side effects that cause concern. Headache, fluid retention, joint pain, and hair growth can occur. Don't be afraid to take these medications just because of its side effects. Keep an accurate record of your blood pressure and any side effects you experience. Talk with your healthcare provider or pharmacist about your concerns. Over time, the benefits of a vasodilator usually outweigh the possible problems. Be on the lookout for these upcoming videos. In the next video, we will discuss medications used to treat diabetes. Contact Macon Carroll, pharmacist at Duren's Pharmacy, if you have questions or need assistance with your medications. You are invited to join us at our monthly Healthy Heart Club meeting. We meet the second Tuesday of every month at 7 p.m. at the pharmacy. Bring a friend and join us as we learn about heart health. Thank you and have a wonderful week. Special thanks is extended to Dr. David Pope at CreativePharmacist.com for allowing us to use the Healthy Heart Club resources for this presentation.